Hey everybody, I'm Holly. I'm currently interning at Hospice Visions. This is a hospice agency that was founded in 1995. It serves the Magic Valley, which is an area in southern Idaho, and it's the only freestanding, locally operated, not-for-profit agency in the area. The mission of hospice statements is to provide exemplary service to patients and their loved ones who are coping with the challenges of life-limiting illnesses, and to provide outstanding community education on issues of death, dying, quality of life, and bereavement. The social problems that are addressed in this agency are a plan of care for both the patient facing the end-of-life diagnosis and the support for family and caregivers. This is a really scary thing to go through, and our agency really works to provide great care and support for people going through this. The other thing that we try to do is no patient will be turned away because of inability to pay. There are many guidelines set in place for hospice care, and these CMS guidelines, they're guidelines set in by Medicare, and upon admission, an RN must complete an assessment within 48 hours, and then within 5 days, the other interdisciplinary members must complete a comprehensive assessment. There are admission and screening standards. Somebody needs to have a life-limiting diagnosis of 6 months or less. Now, can people stay on longer than that? Of course. Some people's diseases don't follow the normal disease progression, so it might, not be as quickly of a death as others. This is why it's important to have those certifications and recertifications to make sure that somebody's still appropriate for hospice care. And there are volunteer hour requirements. 5% of hours need to come from volunteer hours. That's a guideline set in place as well. There are many services offered through Hospice Visions. Of course, hospice is one of them, and support for caregivers. There is a hospice house. If somebody doesn't have a safe place to stay or doesn't have the support that they need, they can stay there. The Dream Foundation is kind of like a Make-A-Wish program for people on hospice. And then We Honor Veterans program we participate in. Hospice Visions is actually a level 5, which is the highest you can be. It just means that they provide extra care and honor for veterans. Our funding sources mostly, as you can see, come from Medicare and Medicaid. We do get a little bit from private insurance, and then we get grants and donations. We have a lot of fundraisers that we do, and then our hospice house, if somebody does the cash pay route, they make some money that way as well. Since we are a nonprofit, we operate under a board of directors. So we have a medical director who kind of runs the board of directors, and then we have these other members as well. Here is our organizational chart. This, as you can see, covers a lot of departments. Here you can see the social workers. We also have a bereavement coordinator who is also a social worker, and then we're also in with the chaplains as well. We have our leadership. So we have the executive director. The other one I wanted to point out was the medical director. This is a physician who is over the hospice physician and the other primary care providers. We also have the clinical supervisors who are over the clinical staff, the nurse case managers. They guide the interdisciplinary team and the care for patients. And then the social services is over the social workers and the chaplains. There is a lot of staff that operate in hospice. So we have the ones I wanted to point out, home health aides. They provide extra care at the home, light housekeeping, cooking, laundry for people. The social worker, obviously, I've heard her say that the nurses provide the medical care, the chaplains provide the spiritual care, and social workers kind of do everything else, the if you have a need in there. For example, last week we had a patient who wanted to get her ear pierced. Obviously on hospice, she can't just pick up and go to the mall and get her ear pierced, so we arranged to have somebody come to the facility to pierce her ear. It was a really great experience. It meant a lot for the patient, but it also meant a lot to the social worker and I to be able to provide this service for her. Again, volunteers, they can provide anything from, do you need an errand run? Can I get you something? Like I've heard people going to go get them a milkshake, or, and they can volunteer in the office as well to help out with anything in there. The goals of Hospice Visions, of course, they need to stay in compliance with those Medicare guidelines. There is another set of guidelines called CAPS, and that's it's a consumer. Oh, there it is. Sorry. Consumer Assessment of Healthcare Providers and Systems. And this is a survey that is sent to caregivers after the death of a patient. Another goal is to educate patients. We heavily emphasize education. As hospice providers, we can't always be there with patients, so it's important to educate the patients and caregivers for what to expect. And along with that, we want to make sure that if somebody is in need of a little extra time, to make sure that we get there on time to support somebody, if they might have an urgent need, to get there right away. And then again, we also provide high quality care to veterans. That's a goal that we have in Hospice Visions. This is a picture of me at the butterfly release. This is one of the community activities that we do. This is both an opportunity for community development. It was a kind of a healing thing for people to do, to release the butterflies, in honor of their loved one, and also to earn money for hospice programs, for people that can't pay for hospice, earn money for our hospice house. There's many fundraisers that Hospice Visions does have. I just went yesterday to a motorcycle rally for veterans. It's just a really neat experience to go to these community activities. And Hospice Vision operates from a case management model, which I think is kind of the standard for most hospice agencies. That nurse acts as the case manager and coordinates the care for the patient. And again, our methods of accountability, those CMS guidelines, are very important. We wouldn't be able to stay open if we didn't have those. The CAPS guidelines are also something that our staff really looks at, just to see where they kind of stand with the patient care. And then staff monitoring, so there is a clinical supervisor that tracks data for visits and assessments and makes sure that we're staying in compliance. And then she reports that to the rest of the staff so we can, see where we need to make improvements. That is Hospice Visions in a nutshell. There's so much more that I could say, but if you have any questions about it, feel free to reach out. I'd love to chat about it. I really have enjoyed my time here, and thanks for watching. We'll talk to you later.